Good morning. My name is Cristina Bescos. I'm the Director of Innovation at EIT Health. I would like to thank the organization of the Heart Failure Policy Network for inviting me to give this talk prior to your discussions. I apologize for not being able to be there, but I hope you can enjoy this small presentation about opportunities and trends in innovation in health. Heart failure is a special topic for me because I've done many of my research topics around heart failure, and I think it's really crucial because it has two probably contradictions. One is definitely from the chronic disease is the one that touches most elderly population. And this is really a challenge when we talk about technology and innovation. But on the other hand, it's one of the areas where there's most potential for saving, especially in the area that you are discussing today, how to transfer diagnostic and caring capabilities towards the community and the home. Let me start talking a bit about EIT Health. For those of you who don't know, the institution is part of the European Institute of Innovation and Technology. The part of health was created in 2016, and we are part of the Pillar 3 Innovation in Europe of the Horizon program. Our mission is to tackle the health demographic change and well-being really by powering innovation and technology with the triple aim of better health for all, improve the sustainability of the healthcare systems, and improve the competitiveness of the European startups and industry. We are a network of more than 150 partners from academia, business, and research. And this combination is what we really think that can tackle the complexity of the health problem. So we need to put together academia, research, and business in what we call the knowledge triangle. Our network is distributed all around Europe with 8 regional innovation hubs and an InnoStars ecosystem also for the Eastern countries. We are working on a combined business model of European grants and other funding sources, and we are from this year, concentrating our efforts in 4 specific strategies that we are calling the flagships, and I'll come back to that a bit later in the presentation. The presentation of today is about the challenges and trends in the healthcare, and for that we need to look at this triangle that has 3 parts. First is generally to the challenges in general, probably coming from the trends in the population and in the workforce. The second is related to the demand side. So what are really our customers, our patients and citizens are looking for? And the third one is the scientific and technological supply trends, the technological push. If we see about the first part, the healthcare system, the biggest change is really with the elderly population and the rise of the chronic disease, but there are also other trends that you can all identify, the shift towards prevention and healthy living, the patient-centric approach, and also the challenges coming from the workforce in terms of shortfall of professionals, and also challenging the quality of the healthcare and the cost of the current situation. If you go to the demand side, there is a clear shift toward patients taking more ownership of their own treatments and becoming more digital savvy. I understand that, I mean, healthcare failure, as we commented before, it started in general, a very elderly population, but even them and even these patients have caregivers or have family members that are also digitally mature and are looking for more solutions and more contact, more response from the healthcare systems. We see definitely trends also in terms of the importance of mental health and how we are integrating and communicating between healthcare and the patients themselves. With regards to the supply side, I don't want to go into all the details of the slide, but definitely pay attention on the data. It's all about data, and it's not only the data in itself, but what to do with it, the area of artificial intelligence, digital therapeutics, and how to incorporate real-world data into the evidence of the treatment of the different patients, more digital solutions, especially telemedicine after the pandemic, and incorporation of more technologies like robotics and wearables. With all that, what we can see is from EIT Health, we wanted to concentrate on big areas that can really mobilize all our community, from business research to education and healthcare. And these 4 areas are: first, new models of deliver healthcare. And where we are looking here is not for, again, another technology push, but looking at the many technologies that we have mature. The real innovation that we are lacking at the moment is in the area of service and business innovation. We need really to transform the healthcare systems towards value-based models. The second flagship is related to the uptake of digital medical devices, especially on the area, I mean, what is related to patient management. And so these in general are low-risk technologies that are already available for many other sectors, but in the healthcare, we are lacking this fast implementation, testing facilities, and fast incorporation into the reimbursement models. The third flagship is related to the reindustrialization of Europe, and we are supporting deployment of the important project of common European interest in health, both in the area of biotechnology, vaccines, and advanced therapies, but also in the second wave in digital health. And the fourth flagship is all around the supporting of the European health data space, and the role that we are taking at EIT Health is not in the infrastructure, but really in optimizing the potential of this data that we have spread all around Europe in different formats and in different places. If we look at the portfolio of EIT Health in the past, and we were active, as we said, since 2016, there are different diseases that have been specifically addressed by our portfolio of more than 150 million euros in the last 6 years. And we can see that cardiovascular had a very important role. And in the future, looking at the projects that have been already approved for the next 2 years, definitely cardiovascular is the biggest area. I would like to address just 3 examples of our portfolio. In EuroHeart is a project that is creating a digital 3D twin image of the heart, so that is a tool to improve the diagnostic and the personalized treatment for the surgery of the cardiovascular patients. The second project is Corify, the startup. The project is called SafeCore, and it's also a diagnostic tool to improve the detection of arrhythmias, and it's also trying to transfer this diagnostic capability from academic hospitals to lower levels of healthcare delivery. The third project is called Better at Home, and it was a multidisciplinary project, so it's covering the management of chronic patients in different therapeutic areas, but it's about exactly the topic of today, how we can translate the management of these patients out of the hospital. So it's a project of hospital at home, and it had really fantastic results during the pandemic, where really the direct interaction between the hospital and patient was impossible. I don't want to close without talking about education. That is also one of our pillars, because all this healthcare transformation that we are discussing cannot happen if we don't have the right workforce. So there is a special need for upskilling and reskilling the healthcare professionals. And we need to educate our staff not only in entrepreneurship and in digital skills and in digital competencies, but it's also about the importance of the healthcare transformation and how these innovations are going to affect their daily life. And last but not least, I would like to close with this global trend about the synergies. One thing that we have realized after many years of technology and innovation, I think globally, but especially in Europe, is that we cannot do the thing alone. So coming from the Sustainable Development Goals of the UN, and especially those related to health, how the European Commission has set up the priorities for the next years until 2024, where there is a combination of policies that are affecting our health, but it has other components like the digital age, the Green Deal, the importance of the workforce and the competitiveness of the European industry, but taking in consideration our values, way of life and democracy. And EIT has these four flagships also to represent our main goals, as we have said, that is the better health for the European citizens, the sustainability of the healthcare systems, and improving the competitiveness of the European economy. So I hope I have given you enough food for thought for the next session. So thank you very much. And you have here my contact details if you need to reach me. I'll be happy to hear from you. Thank you very much.